Ladies and gentlemen, the opening ceremony is going to start in 5 minutes. Please mute your speaker and have a seat. Before entering the event, let me read the participants' rules during the conference. First, participants use their own names on Zoom identities. Second, participants are required to change the display name with the following format: name non-presenter, name underscore institution, oral presenter, code presenter underscore name, poster presenter, code presenter underscore name. Third, turn on the camera and use a virtual background. Fourth, participants must dress modestly and neatly. Fifth, participants are required to turn on the microphone during the conference. Sixth, the microphone can be activated during Q&A session. Seventh, events using Zoom or YouTube applications in their respective places. Good morning, ladies and gentlemen. We are delighted to welcome you to the first UNJAYA International Conference of Health Sciences 2022. Strengthening quality of healthcare service through clinical practice, education, and research. First of all, let me introduce myself. My name is Siti Anissa Irsan, and I am the Master of Ceremony for this event. To begin with, allow me to read the agenda today. First, listening to the national anthem. Second, dance performance. Third, the welcoming speech from the committed chair, the UNJAYA International Conference of Health Sciences. Fourth, an opening remark by the Rector Universitas Jenderal Ahmad Yani Yogyakarta. Fifth, praying. Sixth, photo session. Seventh, keynote speech and panel session. Eighth, poster presentation. Ninth, oral presentation. The honorable distinguished guests, ladies and gentlemen, to honor our country, let us all rise to listen of the national anthem, Indonesia Raya. Thank you. Please be seated. Now, we will move to the next agenda of the ceremony, dance performance. Please the operator to display the video.
Di dalam rasa bergetar dalam alunan sang asmara, gelora di dalam jiwa. Terbang seakan raga ini terbang, melayang bersama sang dewa asmara, gelora di dalam jiwa. Dewi malam getarkan rasa di hatinya, rasa cinta rembuhkan jiwa dan raga. Bintang-bintang megah bertabur di angkasa, janji sakti tulisan para pujangga.
ing sarina lan wengine datan ginggang sarambut lamun adoh caketeng ati yen cedhak tansah mulat sida asih luhur pindho mimilan mintuno ayune mas bareng hanap tepu aja cipto asih gayan. pawitane luput pisan kena pisan yen gampang luwih gampang yen angel angel kalangkung tan kena tinumbas arto.
Ladies and gentlemen, now we move to the next agenda, speech from the committee chair of the first UNJAYA International Conference of Health Sciences, Mrs. Rizky Wahyu Hidayati, Master of Nursing. Mrs. Rizky Wahyu Hidayati, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning. Thank you for the master ceremony. Good morning, ladies and gentlemen. It is a great pleasure for me to welcome you to the first UNJAYA Universitas International Conference of Health Science, UNICS. My name is Rizky Hidayati, the Chief of UNICS. I'm very thankful to you, especially to Dr. Joko Susilo as a rector of Universitas Jenderal Ahmad Yani Yogyakarta and the vice of rector, and then Mrs. Ida Nursanti as the Dean of Health Faculty of Universitas Jenderal Ahmad Yani Yogyakarta and the vice dean, and the Professor Aris, the Dean of LL Dikti 5 Yogyakarta, and then the speakers that's from US, Farsha Singh, and the Japan, Professor Aizawa, and from Australia, Professor Linate, and then from Indonesia, Professor Akhiriani and Mr. Darussalam, and then Boni from Eswatini, Africa. I also thanks to the guys and the participants for taking time out of your schedule to attend this event. I also wish to thank the committee we have organized this wonderful event here. As we know that the COVID-19 pandemic is still existing, we have lost our friends, family, colleagues because of this pandemic. Today, the increasing number of the cases also still happen. The fluctuative situation make the people feel stressed and anxious. Thus, health practitioner is the first line in improving the better world and the better health. Not only psychological, but also physiological aspect is needed to be aware. As the effort in improving of healthcare, we need to stand together through education, research, and practice. I'm also especially honored to welcome the representatives from each university who participate in this conference. The participants who this conference not only from university in Indonesia, but also the participants from university in Malaysia. The total presenter is 76 presenters. There are 47 the oral presenters, and then the 29 are poster presenters. Moreover, for our corporate journals such as Media Ilmu Kesehatan, El Kawani, Aisyah Public Health Pring Sewu, Formil, Disease Prevention and Public Health Journal, and UNJAYA Press, and also Yakult BPDDIY, which is putting their trust on us. Finally, thank you for being part of this event into a better health service in Indonesia, and be fun for joining UNICHS. Thank you.
Thank you very much to Mrs. Rizky Wahyu Hidayati for the speech. The next agenda is a speech from Director of Universitas Jenderal Ahmad Yani, Yogyakarta, Dr. Joko Susilo, Master of Technical Engineering, will also officially open the conference. Mr. Joko Susilo, time is yours.
Jangan. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. First of all, let us thank to Allah SWT for blessing and guiding us into the right path and for granting all means and opportunities to gather here to participate in this very meaningful occasion. On behalf of the Universitas Jenderal YOGYAKARTA, we are incredibly honored and pleased to welcome you all in the first UNJAYA International Conference on Health Sciences 2022. As we know, collaboration is important for us, make us feel confident and strong, especially in this health sector. We are as society need to realize how health sector take an important role of improve our health. I strongly agree with this event, which collaborate with practitioner, expert such as doctor, nurse, midwifery, healthcare provider, practitioner, and scientists through the clinical practice, education, and research. For example, in this practice area, we together provide the best service to the client, family, group, or communication with holistic care. In the field of research, we apply our best finding theory or we access our hypothesis before apply it. And the last, in education field, we can run timeless learning even we get older year by year. We also can collaborate in the form of sharing knowledge together like study. We meet together in this forum, UNJAYA International Forum of Health Sciences. I strongly agree with nursing studies program and nursing internship program of health faculty to have this event. I hope this activity will be useful for everyone. We would also like to extend our gratitude especially to all the speakers. One, Prof. Aris Junayadi, PhD, as our keynote speaker, and also the head of the LT5 region of Yogyakarta. Thank you, Prof. Aris, for your participation, contribution, and support. As Prof. Farsa Singh from United States, thank you, Ms. Farsa, for taking and part in this conference. Professor Akhir Yani Suhaimi Hamid from Universitas of Indonesia. Thank you, Prof. Akhir Yani. Prof. Nariko Alsiwa from Takasaki University, Health and Welfare. Thank you for joining us today. And also for all the speakers who are going to join and participate in this event tomorrow. Dear all speakers, thank you for accepting our invitation become the invited speaker to the International Conference. Ladies and gentlemen, finally, allow me behalf of the big family of Universitas Jenderal YOGYAKARTA to open the first UNJAYA International Conference of Health Sciences 2021. I wish you gain some benefit, favorable outcome and joys in this international conference. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much to Dr. Joko Susilo for the speech and opening this conference. Now, we will praying together. Mr. Debi Zulkarnain, SCOP and SMMR, will lead us to pray. Mr. Debi Zulkarnain, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadar Rasulullah sallallahu alaihi wasallam wa ala alihi wa ashabihi amma ba'd. Dear ladies and gentlemen, participant of the first International Health Science Conference UNJAYA. On this happy occasion, allow me to lead a prayer so that the activities for the next 2 days can run well. As for the prayer, that I pray according to Islamic religion guidance. For non-Muslim, please adjust. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Allahumma sholli ala Muhammad wa ala ali Muhammad. Rabbana dhalamna anfusana wa illam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana taqabbal minna innaka antas samiul alim. Rabbis rohli sadri wa yassirli amri wahlul uqdatam min lisani yafqahu qawli. Allahumma barik lana fi amrina, Allahumma barik lana fi majlisina. Rabbana la tuzigh qulubana ba'da id hadaitana wa hab lana min ladunka rahmah innaka antal wahhab. La ilaha illa anta subhanaka inni kuntu minadh dhalimin. Ya Allah, ya Rahman, ya Rahim, we thank you, we surrender and pray. Hopefully, the first UNJAYA International Health Science Conference today, you give fluency and blessing. Knowledge can be disseminated to the world's community and applied to all health disciplines. Ya Allah, ya Rahman, ya Rahim, give our presenter and all participants of the first UNJAYA International Health Science Conference, you give health, relaxation, always be grateful and happy, so that with this forum many benefits are obtained. Friendship, knowledge sharing, new friend, and knowledge that is full of blessing. Ya Allah, ya Rahman, ya Rahim, with your blessing, all participants can apply services to the community with superior and leading quality by following the value of Jenderal Ahmad Yani struggle. Become role of model in clinical practice, become trustworthy educator and reputable researchers. May Allah accept. Amin. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Allahumma sholli ala Muhammad wa ala ali Muhammad. Alhamdulillahirabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much to Mr. Debbie Zulkarnain. Ladies and gentlemen, we will have a photo session for the documentation. Since we have a lot of screen pages at this conference, there are more than 400 participants at this conference. So, taking pictures will take a couple minutes. Our committee will take your picture on every screen. Make sure you give the best smile. First pages. Next, second pages. Next, third pages. And next, fourth pages. Next, 5 pages. Ladies and gentlemen, this is the end of the opening ceremony. The committee want to thank the main sponsor of this event. First, Kemendikbud Dikti. Second, Bank BPDDIY. Third, PT Yakult Indonesia Persada. 4. Several journals have signed an agreement, including Jurnal Ilmu Kesehatan from Aisyah, Journal of Islamic Science and Technology from El-Kauni, Disease Prevention and Public Health Journal, Jurnal Media Ilmu Kesehatan, and the last, Jurnal Forum Ilmiah Kesmas Respati. Fifth, Himika UNJAYA. We are now continuing our conference to the main agenda. We have Professor Dr. Aris Junaidi, PhD, from LL Dikti Region 5 Yogyakarta as the keynote speaker. First of all, please allow me to introduce our moderator, Mr. Suwarno, Master of Nursing Science. Let me introduce our moderator. Here his curriculum vitae. Mr. Suwarno is one of the nursing lecturers at UNJAYA. His academic background are Bachelor Degree and Nurse Internship Program at UMY, Master of Nursing Science at Konkan University, Thailand. He is active in both national and international organizations. He actively participates in training activities and has received awards. In addition, he does a lot of research and community service. Ladies and gentlemen, please join me and welcome Mr. Suwarno, Master of Nursing Science. Time is yours.
Okay, thank you, Miss Anissa. Hello, everyone. Ladies and gentlemen, welcome to the first UNJAYA International Conference of Health Science 2022. I am Suwarno. You can call me Arno, and I'm going to be the moderator along the conference today. What a great moment, finally, we are here together to have this prestigious conference with our 4 awesome speakers today. And tomorrow, we have 3 speakers who will share their knowledge to you all. Ladies and gentlemen, our first speaker is Professor Aris Junaidi, PhD, from the Higher Education Service Institute, Region 5, Yogyakarta, or we call it LLDT 5, Yogyakarta. The second one is Dr. Farsa Singh, the NP, APN, CTCP, and EABC, FAHA, from United States. The third one is Professor Akhiriani Suhaimi Hamid, MN, DN, SC, from the University of Indonesia. And the last one is Associate Professor Noriko Aizawa from Tokyo University, Japan. And she is as the lecturer from the University of Tokyo, Japan. Without any further ado, please welcome first speaker, Professor Aris Junaidi, PhD. Let me introduce you to all the audience here. Professor Aris. Hello, Professor Aris.
Hello, Mr. Arno.
Okay,
Nice
thank
to see
you, Professor
here.
Aris, to join us today.
Thanks.
Okay, I will introduce you to all the audience here. Professor Aris Junaidi, PhD, is the head of the LLDT 5 Yogyakarta. He is very active, published his article both of national and international publication. He also has 5 books, and he is a reviewer for the scholarship program in Indonesia. For example, Indonesian Education Scholarship and Indonesian Endowment Fund for Education Scholarship. To Professor Aris Junaidi, PhD, the time is yours.
Thank you so much, Mr. Arno. This is great honor for me to be a first speaker for this very important conference today, the first UNJAYA International Conference of Health Sciences. Honorable Rector of UNJAYA, Dr. Joko Susilo, and also the honorable speaker today, Farsa Singh from the United States, Prof. Akhiriani. Nice to see you here. Long time no see, Prof. Yani, and also Prof. Noriko Aizawa from Japan. Ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Very good morning to all of you. This is a great conference, and the participant number is more than 400. So congratulations for Rector of UNJAYA and also for the committee chair. So please allow me to share my PPT today. Okay, I think from the committee will be okay. Thank you so much. Please full screen for this. Dear participants, ladies and gentlemen, I would like to take this opportunity to talk about 20 minutes for the title of our presentation, Elevating Work Readiness Through Independent Learning, Independent Campus. As I think this program is already well known in Indonesia, since this program is just launching in the year 2020, we call Merdeka Belajar Kampus Merdeka. Next slide, please. Next slide. Yeah. Mr. Arnold, can the IT person can help me view my slide through slide by slide? Otherwise, I can share my screen by myself.
Okay, I will ask
Okay.
the committee.
Thank you.
Yeah.
So the second slide I just showing that this is the profile of the Indonesian higher education in Indonesia. This slide showing how big, how huge the number of higher education institutions in Indonesia. There's nearly 4,593 in terms of the number. And also the student body here in Indonesia is 8,704,000. The number of lecturers around 286,000. So this showing the statistic of higher education, how big our university in Indonesia, and how the policy of the Ministry of Education, Culture, Research and Technology. The next slide, please. So before I start about the Merdeka Belajar Kampus Merdeka, I would like to talk about the challenges of civilization today, known Society 5.0 and Industry 4.0. It's very familiar with us that the generation of Z or generation millennial now is hampered with the challenge of civilization. Known as super smart society, for example, is familiar in my ear here about Internet of Things, big data, artificial intelligence, 5G or robotic, as well as from the industrial point of view upon the cyber physical system. And now, our ministry now have the new policy how to hamper the challenges for our generation currently. Next slide, please. So based on the World Economic Forum, the sources from the World Economic Forum 2017 showing or mentioning that our student must have 16 added skill for the student to hamper the challenges of the civilization. So, based on the World Economic Forum, we divided by 3 columns here. The first column is about the foundational literacies. The foundational literacy is very needed for our student, our millennial student here, that our student must apply a core skill to everyday tasks. As we know that every day, so many challenges for our students. For example, we known as a pinjol, for example, currently in the newspaper that many students from nationally have the debt from the pinjaman online. So why this is needed? So our student, our generation of millennials need the financial literacy, so they can use this skill with everyday tasks. Yeah. Need the literacy, numeracy, scientific literacy, financial literacy is very, very important, as well as cultural and civic literacy. The second column is about the competency asset that our ministry is always push our lecturer, our rector, our student, they must have the competency, or 4 competency, or even 6 competency, as our ministry always mentioned in every occasion. So this competency is very important to improve, to support how students can approach complex challenges every day. For example, the critical thinking, they have to problem thinking, creativity, communication, and collaboration. The last one, character quality, is very important to what we call it, encourage our students to have the curiosity, initiative, persistent, adaptability leadership, and also social and cultural awareness. This 16 skill is very, very important to give to our generation for our student currently. Next slide, please. The next slide. Yes, this is we call emancipated learning policy, or maybe as a known kebijakan Merdeka Belajar Kampus Merdeka. Emancipated learning, or we call independent learning and independent campus, or emancipated learning. So this policy, this program, give a chance for our student to become independent, to make the student can achieve the dream by himself or herself, and also our student can develop their own dream. So this is actually a very, very nice and good program. So that means student can take up to 2 semesters outside on the campus to get the new experience, as well as the student can get another competency outside this study program competency. 1 semester outside of this study program. This is actually to develop the student to be competitive, to be readiness, to compete nationally or globally to get the job or create this job. Next slide, please. So this is actually emancipated learning that I just talking, that the student can have 1 semester outside the own subject, and also up to 2 semesters have experience learning outside of his campus. So that this is become student can have a freedom of choose multiple pathway to develop competencies, flexible learning, involve self-directed learning, or co-piloting in the learning journey through the flagship on the Mendikbud Ristek, or through the 8 or 9 campus learning activities. For example, student exchange, intensive program, teaching assistant or research, community service, independent project, or experimental activities, or humanitarian projects. So this is the type of learning activities that student can choose based on the study program approval or university approval to be emancipated learning. The next slide, please. We call also the flagship program. Outside of beside the 9 activities from the emancipated learning, we also, the ministry now is launching about the 4 flagship program, intense program, study independent certificate, and also Indonesian International Student Mobility Award, and also the lecturing in the campus, and also exchange student. We call exchange student Merdeka, or pertukaran mahasiswa Merdeka. And each of this program involving at least 50,000 students. So this is amazing, yeah, amazing. Because before this policy, usually the number of activated students, the quota is around 3,000, of maximum is 5,000, but now extended up to 50,000 for each program. And the benefit of this program, that student will be fully covered scholarship by LPDP, so endowment fund. So that means the student cannot spend any money because all will be supported by scholarship by LPDP. So this is, I think, is must be appreciated. This program is very, very benefit for our student. Next slide, please. So this is just in example of one of the flagship program, Indonesian International Student Mobility Award. Each year is around 1,000, or now it's become 1,500 for the student who got they can what we call it take 3 or 4 subjects in the world class top 200 and over. So this is give the inspiration for our students to get the experience in the top 200 universities in the world. So, and all will be fully covered, fully funded by LPDP. So, a student, I think, will get experience with the international environment, with the study with the international people, with the native speaker. So, this will give new experience by our student. They exposed to the international experience. So I think this is a very nice and great program. Next slide, please. And the other program is we call PKM. I think this is very familiar with our student creativity program. We call PKM entrepreneurship, community services, PKM on research, PKM on futuristic constructive idea. So this is also the program that under the Directorate General of Higher Education Research and Technology, under the Learning Affair. This program is already running for several years, but this program for PKM is still the favorite of our student. Next slide, please. Next. And then also we call KKN, Student Community Service Activity. We have a KKN thematic, we have a KKN kebangsaan, we have a KKN bela negara. Yeah. All of them is give experience to our student to be a readiness, to be competitive and nationally or globally. The thematic student community service, holistic pembinaan pemberdayaan desa, or we call village holistic coaching empowerment program, and also student management and share training, empowerment of student organization. They all is part of the Merdeka Belajar Campus Merdeka. Next slide, please. It's also now, as I mentioned earlier, one of our flagship program is intensive program or exchange program. We call Pertukaran Mahasiswa Merdeka. So this means develop cooperation between Indonesia and university to strengthen Indonesia higher education competitiveness. National insight, we have our student can get a wawasan kebangsaan and build a center of excellence, a national insight, and also increasing integrity, solidarity, national between Indonesian students. So they will be mixed between East, Middle, and West Indonesia will be mixed, and we are sharing what we call it, the culture and also solidarity and integrity between our students. Next slide. And then we also have a part of the 9 activities in Merdeka Belajar Campus Merdeka. One of them is entrepreneurship program. We also, under the Directorate General Higher Education, is also provide the fund, provide the grant, yeah, to student creativity entrepreneurship. We call PKM kewirausahaan or entrepreneurship program. Will be supported with 10 million for each proposal, and then what we call it startup akselerasi KBMI entrepreneurship activity for Indonesian student, and also acceleration for Indonesian student, or we call ASMI, and then they will get the final one, entrepreneur mentorship for Indonesian student. So get the mentoring for the what we call it a professional mentor to do this. So I think this is also part of the Merdeka Belajar Campus Merdeka. Next slide, please. So this is just of the example how important the intensive magang and student bersertifikat, work practice. This is, I think, part of the flagship. The company when the intensive take place guaranteed a quality of the intensive process. So they provide the professional mentor and also intensive employee, health insurance, work safety, supervisor. And the second one, that the university prepare for the departure of the student, advisor to finding, to advisor and supervisor, evaluate the student achievement during the intensive program. And part of the Merdeka Belajar Kampus Merdeka, the intensive program will be for 1 semester, and student will get 20 credit. So this is a very, very genius program, I think. The next slide. So what the benefit for the student if the student attending or part of the for flagship program by Ministry of Education and Culture? The student will get the experience as well as increased competency, both hard and soft skill, experiential learning, and also introduction of the workplace, and if suitable, can be recruited by the company. So this is a very great chance for our students to show that they've got the skill, so they can be recruited by the company directly after they finish the intensive program. So this is the benefit, yeah. And also the student not losing the credit and not postponing the graduation, but the student at 20 credit, yeah, after they finish the intensive program. What about the lecturer? The lecturer get to know the industry more closely, yeah. Updating the application of science technology, updating teaching material, the research idea, counseling, and not losing his or her courses because they improve directly in the intensive program for the student with collaborate with the industry. Next slide, please. So, beside all the program that developed by Ministry Education, Culture, Research and Technology under the Directorate of Higher Education, the government will also give the funding to supporting to the university with the purpose that university can easy to implement it the Merdeka Belajar Kampus Merdeka through give the funding. We call matching fund. We also have the competitive fund that the university can apply. And for the successful, for the implemented the Merdeka Belajar Kampus Merdeka. So this is the government funding is very huge, 500 billion, each of the what we call it matching fund or competitive fund. And the goal of this policy to give the readiness our graduate to competitive in the national and global job. So the student, we encouraging them to creating the job, not only for looking the job, but creating through the entrepreneurship program, through the experience in doing 9 activities in Merdeka Belajar Kampus Merdeka. I think that's all. Next slide, please. Yes, I think that's all what we can share for today. This is it's very important, independent learning, independent campus, Merdeka Belajar Kampus Merdeka, to improving our quality of the students, so the student can easily to get the job, and the stakeholder will be proud with our graduate for today. So thank you very much for your kind attention. And now the time I give to Mr. Arno to continue for the next speaker. Thank you very much. Thank you so much.
All right, Professor Aris, thank you for your good presentation. Give applause to Professor Aris. Okay, Professor Aris, I give note in your presentation. My conclusion is Indonesian human resources should have lifelong learning at the 21st century skills. These are foundational literacies, competencies, lecturers, and also students, and also the characteristic qualities of Indonesian human resources. And also there are a lot of policies from Indonesian support to lecturers and students to lifelong learning. Thank you again to Professor Aris. Give applause again to Professor Aris. Yeah. Okay, thank you very much. Ladies and gentlemen, we move to the following speaker. Please welcome Dr. Farsa Singh, the NP-APN CTCP and EABC FAHA from the United States. Let me know you to the all, and she will share her knowledge about stroke management. Hello, Dr. Farsa Singh, are you here?
Yes, I'm here. Can you hear me?
Yeah, I hear you, Dr. Farsa. Thank you for joining us today.
Thank you.
To Dr. Farsa Singh, the floor is yours.
Okay. So first of all, I want to start this presentation with a big congratulations to University of UNJAYA and inviting me to present this passion of mine. Stroke program and neuroscience is my passion. Before I start my presentation, I want to thank Dr. Professor Junaidi for sharing such a wonderful presentation about what are the future options for students. And I really liked the last quote that he shared with us, with the founder, the national founder of education in Indonesia, that let's make teacher out of everyone and let's make every place a school. That is such a beautiful saying. Think about this, that today the students are tomorrow's teacher. And I can say the same about myself. I was a student some time ago, and now it's a great pleasure. I teach at 2 universities. So without much ado, I think I want to present my slide, and let me see if I can share it. Can you see this now, all of you? Arav, can you confirm that you can see?
Already,
yes.
We see your presentation.
Yes, thank you.
Yeah.
So, okay. So today I'm going to talk about significance of nursing intervention in stroke management. I have been practicing as a stroke nurse as well as stroke nurse practitioner for past 15 years. Yes, past 15 years. And I find it so interesting that I'm never going to stop practicing neuroscience. So let's move further. I usually disclose that there is no financial disclosure. For me, I think this is the requirement of a CME presentation. And then I also want to thank my very good colleague, Kartika Rukmi Dwe, who invited me to present at this conference. She is part of our international NP-APN subgroup. So thank you so much for giving me this opportunity. So let's talk about stroke. Let's talk about something what nurses do, what nurses can do, and how they can make a big difference to someone's life. Stroke is a disabling disease. Think about stroke is the only diagnosis which can make a person disabled. That means if anyone experiences stroke, it's possible that they might become bedbound. They may not be able to move. They maybe get paralyzed. So let's discuss what are the global statistics. What are the clinical pathways? These are my objectives. Nursing role as leader and critical thinker. discuss the stroke program and patient outcomes that can be supported through nurse-led initiatives, nurse as a leader. And I will also share some new technologies that empowers nursing intervention for stroke management. So my management strategies are primarily what I do in United States. Okay. So let's talk about why we have to think about stroke and why do we have to pay a lot of attention to stroke. Stroke remains leading cause of disability. It's second leading cause of death. And if we combine death and disability in the world, it is third leading cause. The estimated global cost is about United States. I will talk about in dollars. It's 721 billion. 12.2 million new strokes each year. And when we are talking, think about this, every 3 seconds, someone is experiencing stroke. That means nurses are going to take care of so many patients with stroke. And that's why we need to be ready. Globally, like all around the world, it's 1 in 4 people over the age of 25, they will have a stroke in their lifetime. If we look at the stroke survivors, 67% are under the age of 70 and 22% are from 15 to 49. So what does that mean? That means these stroke survivors, they might require rehabilitation, nursing care for a long, long time. And that's why we need to learn more about stroke. All this data is from the World Stroke Organization. Recently, they had a global conference in Singapore, and they came out with the latest statistics, and I have taken all this information from World Stroke Organization. And another relationship that I have is I am part of the membership committee of World Stroke Organization. So from 1990 to 2019, the stroke burden has increased substantially. 70% increase in the incidences of stroke, 43% of death from stroke. And the increase in stroke burden of patients or people residing in lower income and lower middle income countries. And that's associated with, ability to take care of their life through healthy lifestyle changes. So and this is an infographic which you can also see on the World Stroke Organization website. It gives all the information about what is happening, 10 leading stroke risk factors, high blood pressure, obesity, diabetes, air pollution, smoking, poor diet, high cholesterol, kidney dysfunction, alcohol use, and low physical activity. So stroke is a burden, and nurses need to be ready to manage stroke in very effective way. So I always like to show this slide of brain. And even when I'm talking about brain, which controls everything in our body. So think about that. Right now, you are listening to me, you are watching me, you are trying to comprehend all this information. What is controlling all these functions? That's our brain. It is the most integral part of the human body. And we all must try to save the brain. When stroke happens, brain is impacted. So it weighs about 1300 to 1400 grams, and we all have 100 million neurons in our brain. So think about 100 million neurons that we want to keep healthy all the time throughout our life so that we are not having any kind of cognitive issue, physical issue, coordination issue, because brain controls all the bodily function. So it's really important to understand the structure and function of brain in context with stroke pathophysiology, so that accurate interpretation can be made when we are making an assessment on our patient. So let me go back to what is stroke. The brain, our brain must have a constant flow of blood for normal function. Think about it, it's like a main highway and the cars are going back and forth. The cars must stop, continue to run. They should not stop because these cars have oxygen and glucose. The brain does not store oxygen and glucose. They do not have storage. Like our liver can store glycogen, it can store a little bit of adipose tissue, it has enzymes. But the brain, that traffic line or the road in the brain, it must have constant flow of blood and it should constantly give glucose and oxygen to the neurons to function. So removes the metabolic waste. Carbon dioxide and lactic acid, it must get out of brain, and blood is the medium. It gives oxygen, it gives glucose, it takes away carbon dioxide and lactic acid. Now, for any reason, if this function is stopped, then the ischemia of the brain, it will lead to hypoxia. That means no oxygen. Anoxia, absolutely no oxygen. And then hypoglycemia, no sugar. And the brain stops functioning. Brain is like, if there is no oxygen, if there is no glucose, I'm not going to work. If the brain stops working, the person cannot do anything. So stroke is when there is no blood flow. And I'll show you one more slide to show you how exactly it happens. There is also a category of stroke which is called TIA, transient ischemic attack, which is like mini stroke. It's because a tiny little clot will stop the blood supply, but then the blood supply will resume itself. There is no neurological deficit. So let's look at my next slide. If the stroke occurs, what happens? Look at this artery. There is a dead tissue here. That means if there is a clot here, and if the blood is not flowing through this area is the dead tissue, and the surrounding area of the blood, which is the ischemic zone, that is slowly dying. So when we treat stroke, we are trying to save this blue area, and that is the goal of treatment of stroke. So there are two types of stroke. When the brain has blockage, if there is a blocked artery, it is ischemic stroke. That is, there is ischemia, which can go into infarction. Infarction is a completely dead tissue that I showed you in a previous slide. It can be due to thrombosis. Thrombosis is there is a clot in the artery in one place. It stays there and it becomes bigger and bigger and bigger, and finally the artery gets clogged or blocked or stenosed, and the blood does not flow. Or it can be embolism. Embolism is almost like a traveling clot. It can start in heart, or it can start in the neck artery in carotid, and it can go to the brain. And in this case, the blood will stop in the brain, in the major artery, and patient will experience the signs and symptoms of stroke. 83% of strokes, or now I would say 87% of stroke, are ischemic, and hemorrhagic stroke is ruptured artery. So if the brain artery breaks in the brain, there is pooling of blood. There will be a lot of blood in the brain, and that is known as hemorrhagic stroke. It can be because of rupture of cerebral vessel, intracranial hemorrhage, subarachnoid hemorrhage, AV malformation, that is arteriovenous malformation in the brain, or it can be due to an aneurysm that ruptures. So two categories of stroke, ischemic and hemorrhagic, and nurses must know how to manage. If a patient comes to emergency room, the nurses are the first one to receive the patient in the triage area, so they must be prepared. So first thing, how the nurses will treat a patient. or how the physician will treat a patient if they are coming to emergency room. The first thing is everyone should know what are the signs, what are the symptoms of stroke. So it's not just physicians and nurses, but everyone in the healthcare organization, including nursing students, because stroke can occur anywhere to anyone at any time. So if someone knows what are the signs and symptoms of stroke, it will be so easy to start a code and get the treatment for patient as fast as possible. So who should know about signs and symptoms of stroke? As I said, everyone, which means physicians, nurses, certified nursing assistant, or we call them patient care technicians, pharmacist, rehabilitation therapist, dietary, housekeeper, and in our hospital, anyone, everyone who is in the hospital building, they must know how does the stroke present. And don't forget the last one. I heard Professor Junaidi's presentation where you have to do a community project. Think about doing a stroke education project, because our community members, our people around in the community, they are the ones, they must know that what are the signs and symptoms of stroke. If we can teach them, we will save a lot of lives. And let me show you my next slide to explain you why I think that education for community member is very important. So this is a very simple way of learning how to identify stroke. So everyone should remember, be fast. What are we looking for when we think about be fast? Be fast for stroke, which means look at the patient and see, do you have any balance issue? Is there any loss of balance? Is there an incoordination? Is the patient not able to walk? Then look at the eyesight. Is this patient having any vision issue? Cannot see properly? They have double vision, or they can say, my vision became so blurred, all of a sudden I can't see. Then look at their face. Is there an asymmetry, or the face is drooping? That means it is uneven. Both sides are not the same. Ask them to raise their arms and say, can you keep your arms at this level? And if the arm drops one side, then you have to think, possibly this can be a stroke. Ask the patient to speak and see whether the patient can speak properly. It can be a broken speech, it can be slurred speech, and the family members may say that he is not talking right. Or the patient may not speak at all. Sometimes the stroke patients are aphasic. So if the nurses are assessing and if they can find any one of this, they have to assume, or they may have to suspect, that this is the time to call an emergency. Now, I looked up in internet, and please correct me if I'm wrong, but in Indonesia, the emergency number is 112, correct? So if anyone in the community, if they see these symptoms, we have to teach community also that you have to learn, be fast and be stroke smart, so that we can identify stroke as fast as possible. If you see be fast, which is positive in hospital, you can initiate a emergency code within your system. But if it is happening in the community area, then probably they need to call 112 and ambulance will come and they will bring them to the emergency room. So this is exactly what I talked about. B is for balance, E is for eyes, vision changes, F is for facial droop, A is for numbness, weakness on one side. Stroke patients usually present with weakness or numbness on one side of the body, not bilateral, and trouble speaking. So it's time to call emergency number, and you have to teach everyone around you. Friends, family, students, anyone that you talk to, that stroke must be treated in emergency room. Clinic, urgent care, or doctor's office, they are not equipped to manage stroke. And I will explain you why. So early identification of stroke is very important, and nurses must know the signs and symptoms of stroke. Stroke must be treated by rapid identification. Rapid diagnosis is very important. Rapid diagnostics, such as soon as stroke is suspected, the patient must have a CT scan of the head to find out, is this patient having a stroke? Laboratory test and rapid communication of nurses with the neurologist. Doctor, we have a patient. We are doing CT scan. We want you to look at the CT scan so that we can treat this patient in timely manner. So what is the rapid treatment of stroke? It's called thrombolytic therapy or mechanical thrombectomy, and I will explain you. So to do thrombolytic therapy, nurses must initiate. If the hospital system does not have a stroke system of care, nurses have an opportunity to create a stroke program and develop a stroke protocol. So in that protocol, they can initiate a stroke code. That means everyone, let's focus on this patient as a team. Let's see, someone needs to do labs, someone needs to bring the IV, someone needs to bring the medication, someone needs to do the blood pressure, just like how we do code blue. We call this code blue in United States, but I'm sure you have an emergency code designation for all the patients who have a sudden emergency. So just like those emergencies, stroke should be treated as an emergency. And every hospital must have a trained stroke team. This improves the patient outcomes. The stroke team must be trained for efficient management of stroke. And thrombolytic therapy is the primary goal of treating stroke. And especially, as I said, ischemic strokes are 83 to 87%. That means most of the patient will come with a blocked artery. And what is thrombolytic therapy? Think about if a pipe is blocked, we pour some chemical to dissolve the clot and open up the pipe. This is a similar principle.
Excuse me,
When a
Dr.
brain
Farsa.
artery is closed,
Dr. Farsa, excuse me.
yes,
Yeah. You still have time around 10 minutes again.
yes, thank you so much.
Okay.
Thank you.
With my pleasure.
So thrombolytic therapy will dissolve the clot and it will open up the blood circulation to the brain. And that's why nurses, they must act fast, do the assessment fast, and make sure that this patient is treated in timely manner. So I will say nursing assessment, you have to know time of onset of symptom. Do the dysphagia screening because we want to prevent aspiration pneumonia. Take all the vital signs and continue to monitor and until the doctor says, okay, this patient is fine. Neuro assessment is by NIH. This is a stroke specific scale. Ask about history of any surgery because if we give any thrombolytic therapy, we don't want this patient to have bleed. And do medication reconciliation. Ask what are the medications that you are taking. Do past and present history and ask as many questions you can. So NIH stroke scale, and I'm asking all of you, please take some time to go Google what is NIH stroke scale and read on your own because you will be using it a lot during the practice. So this is the gold standard CT of head. First thing that is done for stroke is CT of head. And here, if you can see, if this is ischemic stroke, you can see this is the area of ischemia and the hemorrhage looks like this. So neurologist will make their treatment plan based on how the CT scan is looking. So in 1995, they found this thrombolytic therapy, and they found that if they give thrombolytic therapy to these patients, 30% of these patients will recover without any disability. And this is a very big thing to have this medication, because before 1995, there were no medication and the patient would stay paralyzed. Now we have TPA, or tissue plasminogen activator. So please take some time to read about this thrombolytic agent and increase your knowledge how to give this medication, what are the side effects. And this is the knowledge that will make you someone superior than anyone else who comes out of the school. In intracerebral hemorrhage, we have to treat patient and manage their blood pressure. And that is 80% of patients will have bleed in the brain if the hypertension is not managed. So what happens in intracranial hemorrhage? Look at this blood. It's going to press on the brain and it is going to increase the intracranial pressure. This patient can die because the brain herniation will occur if this is not treated through surgery. So how do we manage hemorrhagic stroke? We have to monitor our patient really well. Prevention by controlling hypertension, medication compliance, and stroke risk screening. So I'm going to breeze through this couple of slides which talks about only the intervention. So how we take care of our patient? We do monitoring. We monitor if the patient is having any neurological deterioration. We do neuro checks, pupil checks, we do GC scale, LOC, we make sure the patient's respiration, blood pressure, temperature is fine. We turn them so that the pressure injury do not occur. We teach them self-care, and we also teach them how to take care of yourself after the discharge. If the patient goes for surgery, same thing, you manage their cerebral edema, relieve their pain, prevent seizure, you monitor the intracranial pressure and neurological. And then manifestation of ICP, you have to monitor patient very closely in critical care to see if their pupils are changing, if there is any increased weakness. And then you have to check for the late signs. How is their respiration? How is their vasomotor change? Do they have bradycardia? How is their blood pressure? How they are breathing? And the best part on the nursing is if there is any change in patient condition, notify the physician right away, neurologist or neurosurgeon, as soon as possible, and call rapid response or code blue. These are most important stroke quality indicators that we must do in all our stroke patients. We have to treat their VTE prophylaxis by giving heparin, low molecular heparin, or put SCDs, that is compression device. They must have aspirin on discharge. If they have atrial fibrillation, they must go home on anticoagulation. Thrombolytic therapy, we have to do dysphagia screening. We have to give them statin on discharge. We have to do stroke education, very important. Smoking cessation, and they must have rehabilitation such as physical therapy, occupational therapy. So neuroscience nurses, I would say nurses, when you graduate, when you work in neuro ICU, think about getting certification through a national or international certification program. There is an organization, American Neurovascular Clinicians. They offer international certification for nurses who want to become stroke certified. And if anyone has any question, they can reach out to Kartika Rukmi, and she can give you the information. I will share it with her. So this is what the nurses do. They do acute stroke management, community education, post-stroke rehabilitation, and they are the expert who can collaborate through clinical practice, education, performance improvement. Nurse managers, the lead stroke APN director or stroke program manager, who is responsible for advising and supporting. And these are emergent critical care during the post-pre step down and discharge. These are all the activities that nurses do in order to provide a very quality care to stroke patient. And I'm breezing through a little bit because I really want to share this quickly, the innovations that we are using today for stroke management. Number one is the virtual telestroke. So telestroke program is having a neurologist examining the patient from far. We need neurologists to see the stroke patient in less than 15 minutes. So now you see the physician is sitting somewhere else, but the patient is in hospital. This is the telestroke monitor. They can see the images and they can treat the patient. They can do the assessment for far. And then this is a CT scan which is in the ambulance. So while the ambulance can go and pick up the patient from their home, by the time they go to hospital, the CT scan is already done and neurologist can see. Then there are smart pumps. So nurses do not have to calculate a lot. The smart pumps will give the thrombolytic therapy with accurate dose, which is also good for high-risk medication and patient safety, which is high priority. Lastly, the latest technology that I'm using in my practice is artificial intelligence for a very large stroke. So you see, this is the mechanical thrombectomy wire. It goes in the brain and it just pulls out the clot from the brain. And to do that, we have to inform our neurosurgeons in timely manner. So this is the neurointervention unit where we do this surgery under the guidance of CT or MRI. And artificial intelligence application tells us that there is a large vessel stroke, and then we initiate a code and everyone rushes to the operating room at the same time. So here is the phone. This is how our application looks like. We can see the CT images, and this is almost like WhatsApp with HIPAA compliance, patient privacy. Everyone has this phone and application. So emergency room, nurse, physician, me, my APNs, my advanced practice nurses, neurologists, neurosurgeon, hospitalist, everyone is looking at this image at the same time. And if we think that if this patient needs to go to the surgery, we rush the patient right away. And we have treated many, many patients in less than 90 minutes. We have done the surgery just because of use of this app. And you can see, just like WhatsApp, we also chat on this application. Are you coming? Where is the patient? Okay, what is the lab? What is the blood pressure? So we do it at the same time. And finally, this is my very important slide. I really want everyone to understand that we need to educate the community. And we need to tell them that these are the modifiable. We can change it. We can manage it. Hypertension, diabetes, high cholesterol, obesity, physical activity, smoking, and alcohol. Teach your community member to take charge of their life, healthy lifestyle. Because we cannot change age, race, gender, or history of stroke, or genetic, or heredity. Stroke is preventable. Be stroke smart. Teach your community. This is the key indicator of improving health for our community. We want to maintain the quality of life. We want our community members to be healthy so that everyone can enjoy the quality of life. So stroke riskometer is available at World Stroke Organization website. You can take that app and you can use it to calculate your own risk for stroke. So please look it up at World Stroke Organization and advance your role as a nurse, get certified as a stroke nurse, become a stroke champion. Do become a member of professional stroke organizations such as World Stroke Organization, which has so much knowledge about stroke. Become a teacher, learn how to do neuro assessment, learn how to do NIH, create stroke events in your hospital, partner with your emergency paramedics, and encouragement to community members. And consider doing research project and attend stroke conferences in your country or attend the World Stroke Organization Congress. I think the next one is in Toronto. And create an awareness event in your organization about stroke or in October. So the nurse is the most trusted professional in the community. We can make a difference to our patient, huge difference in reducing stroke burden. So be curious, always ready to learn some more, be innovative, be proactive, one step advance, and be a patient advocate, be a stroke smart nurse, be fast for stroke and save lives. And that's all I had to share today. I'm sharing this picture with Dr. Susan Hasmiller. Everyone should know she wrote the IOM, the Institute of Medicine report, and Dr. Loretta Ford, she is the founder of Nurse Practitioner Profession. Thank you so much for your attention.
Okay, thank
And
you.
I appreciate.
Okay. Okay, thank you very much, Dr. Farsa Singh, for delivering the topic clearly and very wonderful presentation, Dr. Farsa. And I'm sorry. I would like to give the conclusion for the Dr. Farsa Singh explanation today. Increasing stroke patient incidence in lower and lower middle income countries, and then learn about stroke. We have to know the anatomy, the physiology, and also the pathophysiology of the brain. And also, we have to know about BFAS. First, balance problem, eyesight changes, face dropping, arm weakness, slurred speech, and time to call emergency number. Okay, once again, thank you very much, Dr. Farsa Singh, for your explanation. Give applause for her.
Thank
Okay, to the participant, if you have any question, you can share on the chat room. Maybe you have to write or type your question in the chat room by adding the address of which speaker you ask. Okay, and ladies and gentlemen, I would like to inform you that this explanation for the speaker today will be panel lectures, and the first one from Dr. Farsa, and the next one is also the wonderful speaker. Okay, I would like to invite for the following speaker, please welcome Professor Akhiriani Suhaimi Hamid, MN, DN, ST from the University of Indonesia. Hello, Professor Akhiriani.
Hi, very good morning.
Good morning, Professor Akhiriani. Thank you for joining with us today in the UNJAYA International Conference of Health Science.
Yeah, it's my pleasure.
Okay. Let me inform you, Professor Akhiriani, to all of our audience here, or participants in the international conference today. Professor Akhiriani is a lecturer nurses professor from the University of Indonesia. She has many publications in national and also international level, and have many books, and she also active in the community empowerment, and she is also our senior lecturer. To Professor Akhiriani Suhaimi Hamid, the floor is yours.
Thank you. I'll share the screen by myself. Well, I'm given an interesting topic on creating the adaptive and resilient people of strawberry generations. Actually, I myself, as a mental health psychiatric nurses, I don't like labeling, particularly labeling the generation. But it is, I hope this is just a way to identify the characteristic of these generations, and then how do we have to deal with this in a mental health perspective. So what is a strawberry generation actually? Actually, this is a Chinese language neologism, which is usually used in Taiwan for Taiwanese people who were born from 1990s onward. As you see, the strawberry is easily bruised, then meaning they cannot withstand social pressure or work hard. They've been so spoiled with the environment, and also that the term refers to people who are insubordinate, spoiled, usually labeled as a selfish, arrogant, and sluggish in work. So actually, the strawberry generation has the characteristic of a positive one. It's being a creative, and they're also critical. Critical means that they don't accept anything the way it is, but always try to criticize, try to think it over. And they're also very close or friendly with the technology, and they are unique, of course, and they are more open to change, actually. But then what would be the traits? The traits mostly the strawberry generations used to be not so willing to take responsibility, and they seems to be weak, lack of resilience. If they ask to work, they need the reason why they had to work. They don't want to work hard, but they want to have a high result from whatever effort that they make. And they also can blame. So can we blame the strawberry generation for behaving this way? Of course, we would answer that it is not, because then they cannot be like their parents who are loyal, hardworking, and do not change jobs every few years. So the steady stage of the parents, particularly, it's very different from these generations. And then why do they always want comfy jobs with high pay, but do not expect to work harder than anyone else? That's why it is labeling them as a spoiled and selfish. And when raising how that they raised the strawberry generation, why that we create these traits of this generation? Because the parenting system mostly the parents used to buy kids whatever they want, and they don't give a quality time. The quality time is symbolized by compensating with the compensation of material thing, and never punishing and helping kids beyond needs. So the kids seems to be not being given opportunity to exercise, to do things that they feel that they achieve something. And also the parenting, the parental control, the unrealistic expectations to their children. The strawberry generation is raised from the perception that members of this generation have grown up being overprotected by their parents. So that will be the conclusions. And the environment, economic prosperity has spoiled this generation. And then they don't need to fight. They don't need to struggle, especially because any times cannot be spent by the parent. It will be compensated with the material thing. So this group of people, they grow up in a protective environments. There is nothing to scare. They have more a family to protect them. It is usually they are a part of the center of attention from the large family or extended family. And they also used to be tantrums to take attention, to gain attention, and when they gain the attentions, then they will repeating the attitude of tantrums. This is the way of growing up of this generation. So in terms of time or years, so it started from the silent generations in the year of 28 to 45, and baby boomer 46 to 64. The baby boomer now has been retired, of course, and they have also Gen X, 65 to 80, and millennial 81 to 96. Gen Z is the most anxious generation to date. Whereas some research results reported that Gen Z are comparatively more likely to seek mental health help than other generations. So the most generation who needs help in mental health aspects is the generation Z, who were born in 1996 to 2012. So how is the relationship between mental health for this generation? WHO says even 1 over 3 adolescent aged suffer from disturbance mental health. And then for the age of 16 to 24 years old, going through a transition period from a teenager going to mature people, and then range time is a time when someone faces to face with many challenges and experiences a new thing. So apart from starting to have legality, law, and responsibility increase, teenager in the period, this is the experience, development, biological, psychological, and emotional until the 20th centuries. So through the data of BPS in 2018 states that the amount of millennial generation aged 20 to 35 years reached 24%. So 1/4 of our population is belong to this generation, and which is equivalent to 63.4 million from 179.1 million. The soul with this age productive between 14 to 65. So it is really shows how dominance the numbers by numbers of this generation Z, who has been so close with the technology, but then they don't want to work hard, but they expect so much in their life. So it's mean in if 1 in 5 residents, it means 20% of the population in Indonesia, or if you have a family, 1 of 5 family members have potential problem disturbance their mental health. When we talk about the mental health, so it means that we also cannot avoid of discussing about the common mental health issues such as the depressions, the potential suicide they might experience, bipolar disorders, and phobias that they are facing. They might also have eating and sleeping disorders or problems. And this is like lack of solid support systems. It's increased the burdens, particularly the family burdens, to deal with this generation. And of course, then the manifested behaviors of these generations would be having the panic attacks, suicidal thought, even committing suicide, as I have stated, and then self-harm as well. So we have to see the impact of these generations, or the way of parental control toward this generation during their growth and development is in the continuum. You can see from the healthy to the ill. healthy, reacting, injured, ill, with the different traits, which is progressing toward disorder or toward disturbances of their behaviors. So when you see the normal functioning and common and reversible distress, and they need self-care and social support. So we can empower them and then also train the parents through the parental training how to deal with this generation. But if they toward the extra points of the continuum with the significant functional impairments and clinical disorders, severe and persistent functional impairments, so they need a professional support as well. Particularly, they need how to deal with the disturbances of the mental health experienced by them. As a holistic nursing, we see it based on the philosophy that for patient that takes into consideration that the whole person as a holistic person with a very comprehensive needs. So the wholeness and healing are nurtured by taking into consideration that each person has unique characteristics. So individual care is needed, but still have to be comprehensive care that they require. So it will involve the physical aspect, social, psychological, and spiritual aspect as a part of the holistic care as a whole. I cannot move it. Okay. Yeah, so this is the healing also is not healing biological aspects, but also the psychological, social, and spiritual aspect. Now, in the psychosocial care, the psychological distress and physical symptoms can be reduced by providing good psychosocial care, thereby the quality of life can be improved. So the coping levels, particularly in responding to the burden experience, can be reduced, and with a consequence limited demand for hospital resources. So the psychological, we know that 80% of the nursing interventions toward the clients is psychological component or elements of the holistic care. And this, of course, the healthcare worker is expected to deliver psychosocial support, which involve provision of culturally sensitive social, psychological, and spiritual care. In this case, nurses play a very important role, particularly when we look at the existing of nurses in giving the nursing care or providing nursing care, characterized by the constant contact, continued contact, coordinative, and advocative. So nurses perform a vital role, as I have mentioned, and the nurses should communicate and also having a dialogue and treating the person affected by the situations that they raise. Then they will be able to make decisions with the role modeling and also strengthening the capacity or potential capacity that they still have. So in this case, building rapport with patients, good communication, good listener, and assessment skill should be present, as the nurses should be competent of. So, but there are soft skills for nurses that they really need to help this. It should be part of what of being therapeutic use of self and in using therapeutic communication techniques. So it is helpful if they can have the through the professionalism and the ability to think critically and having a time management. They know the time that they have to spend and what the prioritized time to be spent for. And this is very important for them as a part of soft skill, as well as communication. Communication is very important. And in communication, it should be based on the empathy, how that we can feel what is felt by others, person that we interact with. And the cultural awareness, so the nurses should be considering the social contact, the social cultural context of the situations that see and the clients in interactions, being positive and always give and transfer positive energies with positive affirmations, and also flexibility. Flexibility is very important for the client, for these generations to learn, but they have choices and they should be the one to select or to choose and put themselves in a self-control. Of sense of control can be improved as an individual. So the nurses think critically, particularly for life-saving procedures impacted by the situations. For example, nurses often monitor and assess a patient's progress. If they notice an issue, they must decide in an instant. So it is blended, the capacity of thinking critically and making decision making. So they have to be capacity to interpret, to analyze, to evaluate, to explain, or describe clearly and transparently, and also self-regulating. As a professional nurse, it is very important to be self-regulated and self-determinant, because as a profession, we are accountable to any decision we make and any intervention that we implement. So the relationship between the nurse and the patient should be based on the understanding and the trust that we have. We are open and honest, and respect, being present, that we offer ourselves to be approachable, and then we are available. It is very important that we are here to help. We are here to assist you. So the establishing report is very important. The nurses and the healthcare providers also create the healthy environment to make them feeling safe, then comfortable. And it's related to how they communicate the feelings that they have, the concern that the nurses have toward the clients. So this relationship will comfort the patients and the family members. And the nurses and the healthcare providers need to be more careful in including the spirituality, sexuality, optimism, and hope while providing psychosocial nursing care to the patient. So I think this is the last slide of my presentations. And I leave it to, oh no, I still have here. Wait, open it. So the communication skills, it is one of the most important competencies the nurses should have. And also that communication means it's not only oral communication, but also the written communications. And the nurse empathy with patients is another soft skill I have mentioned. This is, for example, to make yourself available and approachable. For example, to help nurses better practice empathy and respond to emotion in their roles, training organization created this handy nurse acronym. So I take this as a references. Name the emotions. So you have to to name the emotion, how they feel. It sounds like you are concerned. So if we listen to the clients that they keep on complaining of something, so we have to acknowledge that what it is the concern of the client. And then the second one, understand the emotions. For example, I understand that this is a stressful situation for you to deal with. Okay? Respect the patient, particularly giving a reinforcement. You've been doing a great job. You have been changed a lot. You look more cheerful today as compared than yesterday. So it's respect the patient's change and support the patient needs. For example, I'll do what I can to make this comfortable experience for you. I'm here for you. You can call me, you can discuss with me. Once you feel comfortable, I'm available to listen to you. And explore and ask questions. Tell me more about what you're feeling. So it means that we are ready to listen to the patients. So this is, for example, how the nurses showing the empathy to their patients. And the time patient in the hospital and the ill effects of anxiety and stress, it can be decreased by providing good psychosocial care. We know that once the patient is admitted to the hospital, particularly it's something to do because we know this generation, they are weak in terms of ability to protect themselves because they've been overprotective during their growth and development. And then they might feel they have been the failures, fail to take care of themselves to be healthy, and then they fail to help themselves. They fail to support the family, but they become a burden to the family. So a lot of failure that they experience. So it needs it's required psychological care for this kind of the patient, particularly when they are being hospitalized. And the nurses and healthcare professionals are required to establish therapeutic relationship, which will help to build social, psychological, and spiritual care. And in this case, the nurses must be empowered to use understanding, empathy, and reassurance to bring positive health outcomes in the patients and the family members. Because we know that the existence of the clients in the family will cause the burden to the family, and the family need to be capable of being a support system. So the nurses should be available to support the family, so the family can be supportive to the client or to the family members that they are taking care as an impact of situation in raising their family during this period. But again, I would say that I'm not in favor to label the generation with a special name, but when I did it in a way to be able to describe the traits and characteristics of each generation. This is the end of my slide. Thank you, and I hand it over to the moderator.
Okay, thank you. Wow, it's a amazing presentation, Professor Akhriani, about strawberry generation. Okay, Professor Akhriani, excuse me, do you have available time until afternoon or not? If you don't have time, maybe we can entering to the Q&A session.
Sorry, actually I'm still on my leave in another city, and once I finish with this, I'm leaving. Return to Jakarta.
Okay, thank you.
So sorry that I won't be able to stay.
Yeah, don't worry about that, Professor Akhriani. Thank you for your information to us. And we are entering to the Q&A session to Dr. Singh and also Professor Akhiriani. Maybe the committee saw the question. Okay, so at the chat room of the Zoom meeting, okay. Okay. Oh, the question to Professor Akhriani and also Dr. Farsa Singh. From maybe the first one from Briliana to Professor Akhriani, how to improve our resilience coping as strawberry generation. And the second one to Dr. Farsa Singh from Ari, she or he, okay, from Ari, she or he asks, is every hospital in United States has stroke mobile unit? And how to get license as neuroscience nurses in there? Okay, maybe the first question one, Professor Akhiriani, the time is yours. Hello, Professor. Okay. Okay, maybe next, Dr. Farsa. Are you still here?
Yes, I'm here.
Okay. Could you
So-
answer the question from Miss or Mr. Ari about?
Yes,
okay. Time is
I
yours.
read the question in the chat room. So first thing I want to say, mobile stroke unit is a new technology, and primarily it is for the rural area, not for the cities, because these ambulances will need a very empty road to drive. So it's a new technology, but it's not everywhere, but it's going to become common in, I would say, next 5 to 10 years. We will have more, I would say, advanced technology, because technology keeps developing, right? Think about how our cell phones were a couple of years ago, 5 years ago, if you remember how your cell phone looked like, and now how we are doing everything using our cell phone. So that mobile technology will improve. And when it becomes more feasible and easy to use, everyone will be able to use it. Second question was about how to get certified as a neuroscience nurse. So United States has a very organized way of getting certification. If you have a registered nurse license for United States, you can actually work on a stroke unit. You have to work at least for 1 year. And once you get 1 year experience, there is one organization, it's called ANVC. I'm on the education committee in ANVC. It's American Neurovascular Clinician. And they give you a stroke nurse certification. Also, there is another certification through American Association of Neuroscience Nurses. And they also have the same criteria that you have to work, you have to have that work experience for at least 1 year, and then you can get certified as SCRN, which is stroke care neuroscience nurse, or you can do CNNN, which is certified neuroscience nurse, which is like a critical care certification. So I can share this information with Karji Rukmi, and she can share it with all the students, whoever is interested. I hope I answered your question.
Okay, thank you, Dr. Farsa Singh, for your explanation. Mr. or Mrs. Ari, do you get the point about the answer from Dr. Farsa Singh? Okay, maybe you can type on the chat room. Okay, I understand.
Recording in progress.
Okay. Any other participant who want to ask directly by Zoom meeting? you can raise your hand to Dr. Parsa Singh.
I see one hand asking question.
Yeah. Okay, if there is no participant asked to Dr. Parsa Singh, I would like to ask with you, Dr. Parsa Singh, about the application of stroke management, Dr. Parsa Singh. You mentioned that in your previous explanation, you mentioned about the artificial intelligence. And what is the name of the application, and who can use the application? Is only nurses, or the community, or the patient with stroke can use the application?
That's a very good question. See, there are many applications, and I wanted to show you my cell phone.
Okay.
You can see how many applications are there, right? So,
Yes.
yes. There are some applications that can be used by community members, correct? What community members can use? They can use the stroke riskometer that I talked about. That can calculate the risk for stroke, right? So stroke riskometer is a free application. Anyone can download. Then there are some free applications such as blood pressure management. There is a very brand new application that does continuous blood sugar monitoring. Then there are applications which will store your health information, your height, weight, BMI. Then there are applications which monitors your physical activity. How much did you run? What is your heart rate? How many steps did you walk? So these are all healthy lifestyle changes application. As far as artificial intelligence app is concerned, currently there are many artificial intelligence apps in the market. One is to detect large stroke in the brain. Then there are also other apps which will give you an alert about is it pulmonary embolism, or is there any arterial dissection. So this app will look at the diagnostics such as CT scan or MRI, and based on the algorithm or the logic or the coding which is behind that artificial intelligence, they are able to make very quick diagnosis. And these are all the cases which require emergency management, such as myocardial infarction, aneurysms. So artificial intelligence is developing all this to help us healthcare providers so that we do not lose time and the patients do not die. So I am just asking all the students or all the nurses in this room that be very curious. Look, do Google search, do your research. There are multiple research articles. It talks about the use of artificial intelligence in healthcare. And there are multiple. I would say at least 25 to 30 applications are there, which I cannot share here due to shortage of time.
Okay, thank you very much, Dr. Singh, for your explanation about the artificial intelligence or application. So we can use the application to our patient or to the community to use it, and it's for helpful to the healthcare provider to care the patient with the stroke. Okay, maybe no participant asks to Dr. Singh again. Yeah, thank you very much, Dr. Singh, for your explanation and participation in the first UNJAYA International Conference today. Okay, see you again.
Thank you so much.
Yeah,
My pleasure.
My pleasure. Okay. Ladies and gentlemen, finally, we are in the last presentation, and here we go, the last speaker of today, Associate Professor Noriko Aizawa from Tokyo University, Japan. Hello, Professor Noriko, are you hear me?
Hello.
Hello. Nice to
Assalamualaikum.
meet you, Associate Professor Noriko Aizawa.
Very nice to meet you. Thank
Recording
you very
stopped.
much.
Yeah. Okay. Let me introduce yourself to all of audience here. Associate Professor Noriko Aizawa is a lecturer in community nursing at the Tokyo University, Japan. Is it right, Professor?
Yes, it is correct.
Okay. And at the Tokyo Medical University School of Nursing. She has 20 years of clinical nursing experience at a Red Cross hospital. Okay, to Professor Noriko Aizawa, the floor is yours. 30 minutes, Professor.
Right. Thank you very much for introducing me. And I really appreciate that I was invited to this conference. Thank you very much, Professor Hidayati, called Kiki, that you coordinated very well. Let me share my slide. Hi, is it clear? Right, let me start.
All right.
Right. Okay, thank you again, the president of the university and everybody who involved in this conference. My name is Noriko Aizawa. I live in Japan and currently I work for Tokyo University. Today I'm going to talk about healthcare provider and community for preparation in disaster management, which I have been working for last 20 years in the field as a nurse. Okay. At first, let me introduce today's topic. Today, I'm going to talk about introduction, myself and Tokyo University, and differences and similarities between Indonesia and Japan from the perspectives on disaster nursing and principles of disaster nursing management, following challenges for disaster preparedness in the community, including increased flooding due to global warming, aging population in Japan, then evacuation and public health in the corona pandemic. Okay. Let me introduce myself again a little bit. I am teaching at Tokyo University since last April 2022. As you see, Japan is like this map. Tokyo is here and where I work. And I have been in the community nursing field since 2014. And I live in Tochigi Prefecture, which is next to the prefecture where the university is. And I live with my husband and 11 years old son. This is the university, and we have a campus here for the Department of the Nursing. We have a hospital next to the campus so that the student can go to the practice to the next hospital. I've been working for the Red Cross almost 20 years, and I am committed for the disaster nursing for the last 20 years in the Red Cross Hospital and the International Committee for Red Cross, which is called ICRC, and the International Federation for the Red Cross and the Red Crescent, which is called IFRC. I am familiar with Indonesia because Indonesia is very similar to Japan. and I can share some experiences of the Indonesia. I had the experience in Indonesia for nursing activities, which was in 2004. It was a big earthquake and tsunami in Sumatra Island. I think many of them are still remember. These pictures are just after tsunami hit the island. It is, I was in the town called Murabo in Aceh. And what I was doing, or what the Red Cross activity are doing there was, first we started the tent clinic to the emergency operation. Then we started for the tent visit, where the people who lost houses evacuated to the camp, and we target for the mother and the child because delivery cannot wait. So we visited each tent and checked the newborn baby and the maternity ladies, so on. Then also we had survey that some islands are isolated and there are no help for medicine and daily goods. So we also started to visiting some island. So this is the time that our team started to visit several islands, and one of the islands was Simuru Island. And at the time we worked with the Indonesian Red Crescent, and I was really amazed how the volunteer of Indonesian people are working and committed for helping the country. Okay, let's see the differences and similarities between Indonesia and Japan. Of course, so many differences. For example, languages, religion, and climate, weather, and national governance and politics. Those things might affect our health system and nursing. But also we have so many similarities that both Japan and Indonesia are island countries surrounded by the sea in Asia. Geographically, like Japan is here and Indonesia is here. And of course, Indonesia has so many islands. Because of that, we have disaster, and we are disaster-prone countries, such as earthquakes, tsunamis, typhoons, eruptions. And I think this disaster which related to snow is only for us in Japan. And we are approaching for winter, so we need to be ready for snow soon. We will see the principle of disaster nursing management. Some of you are familiar about the disaster management. We consider the disaster management for nursing is kind of cycle. It's starting from emergency acute phase. When the event happens, it lasts up to 1 week, and we say 72 hours from the event is a acute phase, emergency phase, which we might save the lives. At that period, we concentrate in emergency phase, which we are familiar with, called SCAT, CSCA 3T. C stand for command and control, S stand for safety, and C stand for communication, A stand for assessment. Then 3T like triage, treatment, and transport. At the time, the nurses and all the medical staffs are concentrating to look for survivor and save their lives. After that, we say subacute phase, usually 2 to 4 weeks. Then moving to chronic phase, or we say recovery phase. It depends on the disaster, but it lasts months or years. After that, we say calm or preparation phase. This phase is very important that we can improve the things we learned from the last disaster. We say we have never have the same disaster in our life. So every time we learn the new lessons and we implement, we evaluate, and we act for the next preparation of the next disaster. Of course, after emergency acute phase or together with emergency phase, public health approach is important because people are losing so many things such as water, electricity, food, houses, families, friends, loved ones. So we need to approach for the health, hygiene, and mental health. And especially this phase, we need to concentrate on community health-based approach. People feel that they were saved from the acute phase, but they lost so many things, so they are in the phase of loss. So they need a support, especially from medical workers and including nurses. And delivery cannot wait. So we need to take care of pregnant women and newborn babies and the people who are elderly. When they lose things or they lost people or things, their homes, communities, it's easy that they lose hope to live. So it is important to monitor them and take care of them. Also the children, that some of them are too young to understand what happened and what they lost. And they needed to continue to grow up, to play with kids, to continue education. So we need to see not only in the hospital or not only in the medical facilities, but we need to look community-based approach for people that they can continue life and recovery. To see Japan society, we have so many challenges for disaster preparedness. I will introduce 3 aspects. First is increased flooding due to the global warming. And this is affect many countries, actually whole world. The size of typhoons and sudden and frequent heavy rains are increased. These are pictures that we say this kind of flood or rains happen once in a decade before, or once in 20 years, once in 30 years, or people say they have never experienced before. But this kind of rain becoming very common here. So they are well prepared now, but it comes so sudden and unexpected. So we need to see the new strategy for the preparedness for the sudden rain and the size a bigger size of typhoons. Second is increase flooding due to the global warming, that rivers overflowing and flooding comes above floor level. This happened about 5 years ago near my area. Right side was river floating and left side was residential area before. And because of the long lasting rain, the rivers flowing, then levees collapsed and the water fell into the residential area. And you see the picture over here, when a lot of water entered the residential area, of course, the water entering the house and the water comes above floor level and the house is no more like a safety place for people. People are going up to the second floor, but of course there is no way out. Another one of the flooding is frequency of requiring evacuation. The right side picture is very common of evacuation center. It is also common that this evacuation center is no human rights kind of, because people are rushed to evacuate, but there is not privacy and there is no space for enough as family to stay together. You can see the family is separated only by the paper board. So you can sleep there as a shelter, but you cannot stay comfortably. And this kind of evacuation become also common, that people are left behind in the house. They were warned, there was a warning, but some people never believed that the water level becomes so high. So after rain, that rescue people have to go house to house to pick the people who are staying at home, because there is no infrastructure available, and of course the water and the food is going to be shortage. And this picture also becoming very common here, because elderly people decide not to leave the house and stay at house. So when rescue people visit each house, they have to help for elderly people to evacuate. But when you can imagine people are going to the place where there is no privacy, no special care for the elderly people, of course they might have lose the hope again. So let's see another challenges for disaster preparedness. Second challenge is the aging population, which we are facing in Japan. Japan's population is 125 millions, with 28.8% of over 65 years. We are really aging society. The prevalence of dementia among the elderly aged 65 and above will be 16.7%, which means 1 in 6 people over 65-year-old is suffering dementia. Then this was a shocking statistic. It came very recent that 60% of caregivers are elderly people caring for elderly people. So now the population of over 65 years are increasing, almost 30% of the nationwide. So young people are assisting them, but also we need manpower. Then people are also suffering from dementia. Because of long life, people have starting to have some health issues. Then when we visit some houses to the patient or to take care of a client, the person who are taking care the client is also having some health problems, and two of them are living together. But of course, it is very worrying. And the third challenges for the disaster preparedness in the community now is because of Corona pandemic. And this is Corona pandemic evacuation shelter. People are everywhere and there is no privacy. It is okay to stay as a shelter one night, but you cannot stay 1 week, especially if you need assistance or if you need to go to toilet at night many times, or if your kids are handicapped and you need wheelchair. So we need to separate the special assistance shelters. But thanks to Corona, maybe the space problem is getting better. After Corona pandemic, we need space to avoid the contact each other or other families members. So the space was kept, but we can imagine where did other people went instead of a public shelter. So now the government also recommend to use hotels or private shelters or evacuate as soon as possible to the relatives, friends, to avoid public shelters. So we need to rearrange how to evacuate people safe. It's also challenges now. And the staff also need to protect themselves. It's getting very common to see that people are having eye shield and the partition to avoid direct contact. And of course, disinfect fingers are essential now. Then, since the increase of evacuation, the occasion of the evacuation, many government officials started to prepare for independent tents, well-equipped household evacuation place, which is improved in Japan. So when think of this global warming issues and aging society and Corona paradigm, it's time to improve community health and preparedness for disasters. So what we are going to improve is disaster preparedness, combining self-help, neighbors and community mutual aid, public assistance, and nation aid. We start from self-help. Now we have a guideline that we need to keep essential food and waters at home for 3 days, which you can survive until the rescue people come to a house. And we need to improve the community networks, which many people don't know. Neighbors or people are not familiar with where you live. So you need to be more community friendly lifestyle for the prevention or prepared for the disaster. Then care workers started to collaborate each other among medical or nursing and welfare, and with public or government, that's public services, because one of them cannot do many things, but if we combine and cooperate the side of medicine or side of the social welfare or side of the rescue, then we have an opportunity to save the people and also assist the people for the long term. In nursing management, the acute and chronic nursing system are being strengthened in light of disasters, especially for the facility like hospitals or care homes. And efforts are being made to strengthen home visit nursing. Now this is expanding a lot in the community, that many nurses started to establish the home visit nursing services in the community. It is more friendly for the residents that they know nurses are very near your house. They can visit your house in need of emergency or disaster. So these home visiting nurses as a part of community nursing is expanding in Japan. And empowerment of residents and as social resources or social network. We say social capital now in the community, that each of us can involve in the community movement or community activities, and we know each other in the communities. So we know what kind of handicapped people in the community, what kind of elderly people are living there, or what kind of household are living only elderly people. This kind of empowerment of the community itself is challenges, and we need to improve in Japan community health, and also we need to empower the people as a nurse, as a community nurse. Okay, this is my presentation for the disaster management, especially for the community. Thank you very much. Terima kasih banyak.
Oke, terima kasih kembali.
Thank you.
Yeah. Okay, thank you, Professor Noriko Aizawa, for your great presentation today and bring the topic to be discussed by us today. And you explain more about the similarity and also the differences between Indonesia and Japan. And you mentioned about the emergency disaster management, such as emergency acute phase, and then subacute phase, chronic phase, and also the last is calm or phase preparation. It's very wonderful presentation today to us from you, Associate Professor Noriko Aizawa. Please give applause to Professor Noriko Aizawa.
Thank you.
Okay, thank you.
Thank you very much.
Yeah.
Okay, we can check in the chat room, Professor Noriko Arizawa. There are questions in there. Okay, from Siva Hidayatul and also from Chandra Kusuma. The first question from Siva Amaliana to Ms. Noriko Aizawa. What is the role of nurses in Japan disaster management? Professor
This is,
Noriko, yeah?
what is the role?
What is the
Role?
nurses' role in Japan about disaster management, for disaster management?
Okay.
Yeah.
I think individual nurse has a role when disaster occurred. Especially recent years, we have so many disaster situations. So in the hospital, emergency or ward management is related to the disaster management, such as triage the patient first and categorize which patient goes to which ward. Then chronic nurse management, they need to long-term management, such as chronic disease patient like diabetes or hypertension patient. Once they lose medication, the effect for the body is very critical. So they try to supply for the medication, and also the people who need dialysis and people who are living with machines, like life-saving machines at home. Community nurses need to visit them to supply the electricity or urgent evacuations, which they can connect to the electricity. And also the community nurses at the public health, usually they have a list in the community for handicapped people and elderly people. So first they are going to check the safety. Then if they are not sure where they are going to visit the houses, each houses. Are they safe? Or if they have any problem, what kind of assistance they need? Then the public health nurses connect to the certain professions. So I think there is all nurses are all responsible for the disaster situation, but the nurses in the hospital and nurses in the home visiting care and nurses for the public health care, they have a different preparation to be ready for the disaster. Am I answering the question?
Okay, thank you, Professor Noriko.
Thank you for the question.
Ms. Siva, if you get the point about Professor Noriko explain about your question, maybe you can type your right or in the chat room. Okay, I understand. Or all right, thank you for your explanation, Professor Noriko. Yeah, you can type on the chat room. Okay, Professor Noriko Aizawa, maybe I will conclude about your answer. Maybe nurses can increase their competencies like that, and then such as for in the public health that you mentioned, with public health approach or community-based approach, and then they can collaborate with the community, with the healthcare provider others like doctor and midwifery and etc. Maybe it can help the nurses' role in disaster management in Japan. Okay. The second question from Chandra Kusumanegara. He asked 3 questions. The first one, is there any nurse role in disaster mitigation? And the second question, what about rapid health assessment? What do nurses do? And the last question, in Japan during disaster phase, what did the nurse do after the disaster? Maybe you can ask the first question.
Oh, thank you. I saw the chat.
Yeah, on the chat.
Yes, the what
There is-
about rapid health assessment?
Yeah,
What
rapid
do
health
nurse do?
assessment.
Oh, yes,
Yeah.
of course. It's also the it's connect to the first question. The rapid health assessment is according to the which department you are, but there is a, we say, disaster health assessment team, especially for the public service. When the area of the disaster, the affected area, usually the nurse or public servant or anybody usually who is not functioning, not only patient, but also the medical people, nurses, those people are also victim. So usually the prefecture, we say district, you say district, the nearby district comes to assess the affected area as a team and assist the public health team, because the workers in the affected area also a victim, so they need to also take care of their families, their houses. So other team comes to check at first infrastructure, but how many wounded, how many elderly are evacuated. As I say, there is a list in the community, like how many elderly in this community, how many people are having ventilation, how many people are handicapped. So they are going to share the list, then going to check. So public health nurses are involved in kind of rapid health assessment, then separate according to the needs. Maybe this support team can go to the shelter, this support team can go to the hospital to support the hospital, or this support team can go to the home visiting to assist the public health nurses who are affected by the disaster. So it's a rapid assessment, health assessment, combined with the direct assistance for the community.
Okay, thank you, Professor.
Okay, for the number two
Number
question.
three. Number three.
Yeah. Then in Japan, during the
Yeah.
disaster phase,
What did the
what
nurse do
did
after
nurse?
disaster?
Oh, after the disaster.
Yes.
Yes. As I said, the disaster is we consider as a cycle. So actually, I don't know when is the after disaster. The emergency case is acute phase, but the affected people's disaster continue because most of them lost something. Maybe they lost health, they lost money, they lost family. So physically they are fine, but their mental issue or their sorrow, their sadness, it's really affect their daily life. So after the acute phase, that you saved your life or you injured, but you got proper treatment. But after that, there is mental care, which you can come to talk about yourself, or you can have self-help meeting and organize this kind of meeting is one of the role of the nurse, that people can share their sadness. But not only mental health, they need actual help to recover from the damage. For example, they need house, they need job. Nurse cannot intervene direct to this kind of problem, but we assess the client's problem, and we can refer to those clients to the proper profession, like a medical social worker or psychologist or financial planner, to help their daily problem, not related to medical, but to solve their small problem or big problem. It will improve their independence level and their quality of daily happiness or daily wellness improve. I think this also that nurse can do in the community, or to help each one of wellness to continue living after disaster.
Okay, thank you, Professor Noriko. You explain more about emergency acute phase after disaster, and the nurses' role for that impact the disaster impact to physical and also psychological impact to the victims that got the disaster. Okay, the last question, is it okay, Professor Noriko? There,
yes.
Yeah, the last question?
Is there an alarm system in Japan?
Yeah.
Yes, this is now established in Japan. Like, weather forecast is very correct now. So the typhoon, the news is coming like 3-4 days in advance. Like, the typhoon is coming, when and what time. So people start to evacuate. Before, people were not believing it, because today is sunny, shiny day. Then you cannot imagine the typhoon coming 2 days later. But I think now this weather forecast is very correct, and we see the phenomenon. So people started to believe, people start evacuate, and to assist people evacuate, of course, like us, university can close, let students prepare, and the official close to people to prepare. So the alert system is very early. Then for the earthquake, it's very difficult to alert in advance, but at least a few seconds before the earthquake comes, you can get the message to, usually for your mobile phone, you get the alarm that the earthquake is coming, the earthquake is coming. Then you see that few seconds later, the shaking comes. So this, I really appreciate the technology or scientists, whoever, that they can catch the sign of something is going to start. So you give, even earthquake, you can have a few moments of preparation time. Oh, earthquake is coming, be ready. So this alert system is established by whoever the technology.
Okay. How about elderly who live alone, Professor? Is there any management system in Japan who can carry the elderly when the disaster is coming?
Oh yes. All the small government district has the list. The people who are living alone, And there is kind of, do you know in the hospital, when patient need nurse, patient can call and they call the nurse and nurse come. This kind of system established at home. So people who are living alone or elderly people living alone in the house, like two of them are 80-year-old. So usually they have a like alarm. Whenever they need, they can call. They can press the button, then it connects to the officials. So officials will let the nearest station, or the nearest department, whoever need to go to serve them. Yes.
So many technology that use Japanese people or Japanese government that apply to the civilization.
Yeah, I think Japan is improved technical side, but as I mentioned, we need some human relations in the community to assist each other, because sometimes we don't know who are they in the neighbors. Or 65-year-old person is taking care of 80-year-old mother, or even more, like 70-year-old person is taking care of 90-year-old mother, father. So we need human power and community helping each other. Thank you. And I also want to know the Indonesian side, if you have any aspect of community health in disaster preparedness.
Yeah. We don't have technology until now. Maybe in the future we can develop the technology to help the community if there is disaster, and they can get great disaster preparedness. Maybe now only the community empowerment to disaster preparedness, to promotion and prevention, Professor Noriko, in Indonesia especially.
That is very important. You have young people and you have a kindness of each other. Yes, this human help human is, I think, essential.
Okay. Thank you, Professor Noriko. You did great presentation and you great answered the question to all the participants who asked to you about the disaster preparation or disaster management, and also nurses' role in disaster management. Okay, ladies and gentlemen, this is the end of our topic today at the first UNJAYA International Conference of Health Science. As the moderator today, I do appreciate your participation in our wonderful conference. And for Ms. Anissa, as the master of ceremony today, the time is yours.
Thank you very much for the speakers for such insightful presentation. Now, the next agenda is poster presentation. Please, the operator, to display the poster. Ladies and gentlemen, now we are entering the lunch break. Please be noted that our next session will be start at 1 p.m. Thank you, and we will meet again at 1 p.m. sharp.
Selamat datang di program studi keperawatan Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta. Kampus Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta sangat strategis yang berada di 5,5 km sebelah barat dari Malioboro. Program studi sarjana keperawatan berdiri pada tahun 2006. Sedangkan program pendidikan profesi nurse mulai dilaksanakan pada tahun 2011. Visi program studi keperawatan dan pendidikan profesi nurse Universitas Jenderal Ahmad Yani Yogyakarta yaitu menghasilkan lulusan yang unggul dan terdepan dalam bidang pelayanan kesehatan primer di tingkat nasional serta mewarisi nilai-nilai kejuangan Jenderal Ahmad Yani. Visi ini dijabarkan dalam 6 misi yang meliputi aspek pendidikan, penelitian, pengabdian kepada masyarakat, kerjasama, perwujudan good university governance, dan internalisasi nilai-nilai kejuangan Jenderal Ahmad Yani.
Program studi keperawatan Universitas Jenderal Ahmad Yani Yogyakarta telah mengimplementasikan kurikulum terbaru yaitu program Merdeka Belajar Kampus Merdeka dengan total 145 SKS yang dapat ditempuh selama 3,5 tahun atau 7 semester. Kami aktif mendorong dan mengirimkan mahasiswa untuk mengikuti kompetisi program MBKM yang diselenggarakan oleh Kementerian Pendidikan, Kebudayaan, Riset, dan Teknologi. Kami juga membekali mahasiswa dengan nilai kejuangan Jenderal Ahmad Yani. Kami berharap lulusan perawat Universitas Jenderal Ahmad Yani Yogyakarta memiliki soft skill dan hard skill yang unggul dan terdepan dalam bidang pelayanan kesehatan primer.
Program studi pendidikan profesi nurse merupakan jenjang lanjutan dari S1 keperawatan yang dilakukan selama 2 semester dengan
Ladies and gentlemen, the oral presentation is going to start in a few minutes. Please join the breakout room to have your presentation. And the other participants who do not have presentation, please get in one room to listen to the presenter.